Obsessive compulsive disorder, or OCD, is a mental health condition that affects millions of individuals worldwide. It is characterized by persistent and unwanted thoughts, impulses, or images that drive individuals to engage in repetitive behaviors or mental acts compulsions in an effort to neutralize these obsessions. One subtype of OCD that has received increasing attention in recent years is hyperawareness OCD, also known as mindfulness OCD or scrupulous OCD, which is characterized by excessive and persistent worry about one's own level of awareness or attention. Let's talk about symptoms of hyperawareness OCD. Individuals with hyperawareness OCD experience persistent and unwanted thoughts or doubts about whether they are truly paying attention to their surroundings or to important tasks. These thoughts can be intrusive and can disrupt daily life, leading to compulsive behaviors such as repetitive checking or rechecking one's level of awareness. Such compulsions can take up a significant amount of time and can intervene with work, school, and social activities. Now, to talk about the diagnosis and treatment plans, hyperawareness OCD is often misdiagnosed or overlooked by healthcare providers due to its unique symptoms. It's important for individuals experiencing such symptoms to seek help. But how do you find help if a clinician or professional cannot really provide you with good guidance? Well, cognitive behavioral therapy, CBT, is the most effective treatment for OCD, and it's been shown to show effective placebo treatments and anecdotes that really did work at some point, I think higher than 50%, or at least somewhat, in treating hyperawareness OCD specifically. So CBT for OCD typically includes exposure and response prevention therapies, ERP, which involves gradually exposing the individual to their feared situation or obsession, and then presenting them to engage in their usual compulsion. Medications such as SSRIs, SNRIs, MAOIs, or tricyclics have also been shown to help reducing the symptoms of OCD. Now, hyperawareness OCD is an umbrella term, right? And it's a unique subtype of OCD that's characterized by excessive and persistent worry about the awareness itself. It can be a debilitating condition that can disrupt daily life and intervene with work and general activity. Early diagnosis and treatment, CBT in specific, can be effective in managing symptoms of hyperawareness OCD and improving quality of life. Further research is needed to understand the specific causes of hyperawareness and to develop such effective treatment approaches. It's very important to note that the exact causes of hyperawareness OCD are not well understood, but research suggests that a combination of genetic, environmental, and psychological factors may play a role. Some studies have shown that individuals with hyperawareness OCD may have a genetic predisposition to such a condition, and that certain variations in certain genes may increase the risk of developing this type of OCD. Additionally, environmental factors such as traumatic experience, history of abuse, or others may contribute to the development of hyperawareness OCD. Furthermore, high levels of stress or anxiety, as with perfectionism, may also increase the risk of developing such a disorder. Let's talk about the impact on daily life of somebody with hyperawareness OCD. Now, hyperawareness OCD have a significant impact on the individual's daily life because the persistent thoughts and compulsions associated with this condition can and will disrupt normal activities and routines. Now, individuals with hyperawareness may individually experience concentration difficulty, attention and memory difficulty, and may have problems with time management as they spend a lot of time performing compulsive behaviors. This can lead to problems with work and everything around it, leisure, chores, and the person could be left with great distress. Relationship problems could ensue, and overall decreased quality of life may be the result. Of course it is. Now, in severe cases, such individuals with hyperawareness OCD may become socially isolated and may have a difficult time maintaining relationships. This is one of the negatives you get with such a condition. Now, I can tell you about the solutions to the hyper-awareness problem because I've sat with this problem for 13 years now. But I can tell you that one of the doors has been opened, and we understand a bit more about hyperawareness OCD as we did 13 years ago when I started getting this condition. I didn't know what the hell was going on. Now, there are medications that can work somewhat. There are people that get cured completely, and likewise, there's also people who don't get cured completely, like myself. I might sit with this condition for the rest of my life. I know another guy, another gentleman who's currently online, who has the same problem, who's battled OCD for a very long time, specifically hyperawareness OCD, including a couple other maladies. And he's sitting with the same impeachment. He's unable to get better. At least he's making, marginal gains in terms of getting better, but he doesn't really get much better than this point. There's another lady I talked to before, and she was able to completely overcome this. But her history wasn't really anxiety specific. She was, I'm not going to really give a lot of detail on her, but I would say the condition that I'm sitting with and the condition that the other guy is sitting with, his name is Bodhi Tree. He's sitting with exactly the same conditions I have. I think I've got the swallowing one, but both of us have pretty much the same disorder in various variations. So it's pretty much the same disorder, give or try. I mean, this is the same disorder. And both of us, we didn't fully recover. I don't think we ever will, to be honest. I can talk for Bodhi, but I mean, looking for I think he's been suffering for a decade now. And, anyway, I just wanted to quickly give an introduction to this disorder and say it's a very serious thing to suffer from, because if you suffer from hyperawareness OCD, you will see that your life quality is dismal to what it was before. I mean, many people who suffered from this OCD, yes, you can probably look at a link. Some people have a link to past anxiety disorders. It's not uncommon, it's not unfounded, but this thing usually breaks the bed. I mean, once people get this thing, it's just over for them, because everything in your life is completely impacted. I mean, if you think about just general social life, that's definitely something that goes out of the window. And of course, just general life in general. I mean, the work worry to me is the biggest worry you can get. If you can't work optimally, then of course you are in a massive shit. And this is one of the problems that this thing is giving you. It's giving you the inability to do most things in life, including work, including study, and that's the problem with hyperawareness OCD. Now, the medication is, because this phenomenon isn't widely studied, we don't know enough about hyperawareness OCD like we do about other forms of OCD. Say, we know something about GAD, or generalized anxiety disorder. We know more about generalized anxiety disorder, give it a try, than we know about OCD. And even then, we can keep fluxing. The point is, we know less about OCD, and we know even less about hyperawareness OCD than we know about general OCD than this. So for people with GAD, they do have help. I mean, somebody with GAD can do a lot of prevention therapy, a lot that can be done for somebody who's, let's say, afraid of snakes. Somebody who's afraid of snakes or heights can avoid it. That's as simple as it can get. Now, there might be situations where somebody who's afraid of heights might be exposed to heights and they can avoid it. But for the general rule, somebody who's afraid of heights can avoid such situations and such impediments, whereas somebody with behavioral problems, and especially those with a mental condition such as OCD, have a more difficult time, especially people with a hyper-awareness OCD. These people have no chance at actually avoiding it, because their thinking is eclipsing their ability to live completely. So we have a problem with this thing, and I guess the best my videos will get is an awareness raising. I don't think there's anything else in that this video can actually get to, because I'm very much aware that there's no real cure for this thing. And unless you're going to go through it, I'm very certain that when I actually talk to people with awareness OCD, it's getting worrying. Not least because, I mean, if you look at the awareness side of OCD, it's completely mental. So it means that it's either behavioral or it's neurodivergent, which is a problem either way. In the case where it's genetic, it's a problem, you should be worried. In the case where it's a learned behavior, well, you shouldn't be as worried as when it's genetic. Because in what I kept seeing is this type of OCD is especially genetic. Because the people who have it rough are the people who have it rough in other sides of anxiety, which means it is genetic. And I've also seen that this one is a one to stay. So where